Let's get started. So, first of all, thank you so much for agreeing to speak to me. Can you please start off by introducing yourself with your name and your current role?
My name is Jovana Ocampo, Jovana Alexandra Ocampo Canas. I'm from Bogota, Colombia. I am professor on the School of Medicine.
This month is Women's History Month, so we're taking a closer look at some of the health issues facing women and girls. So much of your career has focused specifically on women and girls, including your work with the United Nations. Can you tell us about some of the biggest challenges that you saw for those communities?
As you know, I work with many different communities. I have helped indigenous women, and I also have worked with sexual workers that are victims of armed conflict. So the challenges vary and depend on the region where the women are. For instance, for the indigenous women, I think the main challenge that they face is visibility as women, both within the community, but also vis-a-vis the region, being it national, the department, as well as nationally, regionally, the department, and etc. And just to give you an example, 2 weeks ago, I visited the region and I heard from the women there that when they received the assistance kit because of the coronavirus, they did not see any female products, meaning tampons, pads, included in it, right? And actually, that's one of the main reasons why they go down to the city. It's because they need these products. Another issue that they face is the fact that outside their community, their culture and their cultural structure is not being recognized. These women have a different perception of how they are as women and how they behave as women, and the relationship that they have with the environment, meaning the nature, and as well their community. And sometimes other people feel that they are ignorant or treat them as ignorant just because they are not expressing what they feel, what they think, because they are not like the other women. They come from a different culture. They have different cultural values. Now, to speak about the sex workers, I can tell you, first of all, that these are migrant women, mainly coming from Venezuela, living in Colombia. And they face many difficulties. The fact that they are women, they are more vulnerable to abuse from people that want to use them to get a benefit from them, to maybe force them as sex workers, or maybe give them, food and shelter or shelter in exchange of sex. When they start working as sex workers, then they are also exposed to violence. Violence, it could be verbal, but it could also be physical violence. I would say that the same situation applies to the women in armed conflict because they are vulnerable. It's the same situation that the migrant women face. They are used as a sex weapon, and they are often abused, aggressed, violated. Just to summarize, I think that the biggest challenge that the women in these 3 different groups that I've mentioned they face, it's the lack of empowerment of their sexual and reproductive rights.
You spent a large portion of your career working with these indigenous women and girls in the Amazon region, like you had just mentioned. How has healthcare for these women evolved in the time that you've been working with them?
It hasn't improved much because the healthcare system is concentrated in the big cities and they don't get out of it. So they don't go to the remote areas. And there is also this still same problem of lack of acknowledgement of their costumes, of their cultural belief system. And so we did something in Bichada. We work with a group of women, and what we did is that we empowered them so that they would recognize what their rights were, and so that they could demand the government to give them the right to honor the rights. And it was the other way around, right? Because normally it's the institutions that have to reach out to these women and help them. In this case, we work backwards, meaning from the ground up, working to strengthen these women so that they are aware and they can demand, they can ask for something, and have institutions understand what the needs are. We are doing the same exercise in another region in Bupes, and it's turning out to be very interesting. We're working with a small group of women, and I think that's the best solution, actually, to work from the ground up, because we can't just sit and wait for the institutions to do something.
While working with these women, what are the tools or techniques that you found that made the biggest difference to the success of the campaign?
You know that I am using these qualitative methods. We call them research, action, and participation. And well, you'll notice that I like to talk a lot. So that's a plus for me, because I like to go to the communities and I talk to the people, and I want to be part of them. I speak with them, but especially I listened. And so I make my way into the community so that I am accepted, I am a part of the community, so that I can establish this horizontal relationship. A second tool or method that has been very effective is the fact that we build together. They are part of whatever we are building. They are part of the process that we are creating. So we start with doing an analysis of the situation. So the community and us, we work together, we analyze together, we identify the main issues, and we use prioritization tools. We do all that so that we set a way forward. We ask ourselves, what tools do we have right now with us, and how can we change the situation? That is something that we call the community-based planification or planning.
Your work has covered a broad range of topics, ranging from reproductive health to gender-based violence to breast cancer. Which of these did you find the most challenging?
It is a very, very difficult question to answer. So if I think out loud, I think about the indigenous communities, and then again, I think about the lack of acknowledgement of their sexual and reproductive rights. And because of that, obviously, diseases such as breast or cervical cancer do not exist because we don't recognize that they have sexual and reproductive rights. So how can we recognize that this cancer could be an issue? But women are literally dying from it. And so that is a problem. And if I think of women in the conflict zones, then again, it's gender-based violence. So yes, I guess the biggest challenge of all, it's the reproductive and sexual rights.
Let's talk about the impact of COVID. So over the last year, COVID has dramatically changed the health landscape. So how has COVID affected the campaigns or the programs that you've been a part of?
I wasn't able to go back to the indigenous communities because of the coronavirus. So I've only been able to go back 15 days ago. I went there only. So after 1 year. And when I asked them, if they notice any change with this coronavirus, they said, change? Not at all. We've always been the forgotten ones. We've never received any sort of protection from the government. So we've always been exposed, right? So we've always been exposed to any sort of diseases, and we've always been vulnerable. So we've always had this risk of dying. So, but something that really affected them was the overload of information, because it was too much information that they received, and they were scared, right? Until they came up to this conclusion that they've always been vulnerable, they've always been at risk, and they've always had this risk of dying. So for the migrant women, the situation was more difficult because obviously they were unable to access any healthcare services, because for instance, in the big cities, Bogota, hospitals devoted their services to coronavirus. And also the fact that you're an illegal because you're a migrant, it doesn't give you any much access to healthcare. And in the conflict zones, well, these people haven't been able to get out of the communities because they have been besieged or sieged. So they can't get out of the communities.
Have there been any techniques that people have used to combat this that you've seen that have been particularly effective, or have there been any techniques that people have used that have not worked at all that you've seen be ineffective in these campaigns?
I think as a researcher, it turned out to be a great opportunity because it allowed me to identify women leaders in the communities. And back then I was working, or I have been working with the topics of migration and food security. And so when I identified with these women, because I wasn't able to go into the community, so I asked myself, so how am I going to interview these women or these people? So I identified these women, I worked with them, and they turned out to be super well, to do a great and outstanding job. They did a marvelous interviews of the people. And I think that this gave me an opportunity of finding a new tool and empowering those in the communities to do a work that they are not used to do, and they did it marvelously well. And the same thing happened in the jungle, because we were unable to get into the jungle. So we decided to bring the people from there and to work with them. So we worked with them, we trained them, we gave them some homework, and then a month after we came back and we asked them, how did it go and what were your needs and etc. And I think once again that this was a great opportunity to see what were the strategies that can work well.
Okay, so moving into our last section now, as people in the healthcare field look at ways to make health campaigns more efficient, many of them have started looking to campaign integration. Have you been part of any integrated campaigns? And if yes, what successes or failures did you see there?
Yes, I have worked in integration of campaigns, mainly because we need to optimize resources. Just in a nutshell, going to the jungle is very, very expensive. So when we go there, when we make a trip to the jungle, we try to tackle different fronts. So mainly family health, the environment, mental health, because we have some young people having experiencing issues of suicide thoughts and things like that, and sexual and reproductive rights. So for instance, now that I went on my last visit, the men in the community identified that there was this need of food safety and nutritional safety. So we came up with a project of probably having chicken that they can be used for self-consumption, and that so we started seeing into that, and the women on the other side, they discreetly came to see us and they said that they needed something for them, and so we said supposedly that we were going to work on a art and craft project, but actually what we're going to be working on with them is sexual and reproductive rights. The fact that you integrate different campaigns allows you to let the community take care and work for a common purpose, right? It is the well-being of the community. So they are working for not one little project, but several little projects, right? So that's how we do it. And basically, yeah, we right now we're trying to do this project on like health diagnosis, like a checkup on the community, as well as other projects that we can be doing at the same time, small projects, and and we try to do small things because there's a lot of activities happening at the same time. So we try to prioritize, and we also try to do one thing at a time and step by step.
Are there any other aspects of your work that you'd like to highlight, or anything else that you would like to touch on today?
This work has allowed me to identify the need for a multidisciplinary approach. So I'm not working alone. I work with many other people, right? And and I work with people that have different professional profiles. So in my team, for instance, I'm a doctor and I work with other doctors, but in our team, there are also sociologists, anthropologists. We have an attorney because it is important for the right to health. We have economists and we have artists that like to work with art and help people out through art. And that has worked marvelous well with the indigenous communities. They are very interested in that. So yes, I've learned that adding up and compiling different disciplines has allowed me to have a multi-strategic, multidisciplinary approach. Most importantly, this work has allowed me to identify the need of involving the people in the community, to also have the leaders join up and be part of our project, because we could not move forward without their very personal perspective. More and more, I have leaders from the community joining and working with us. I think that wasn't that obvious in the past, and it is now.
Thank you so much for agreeing to speak with me today. Thank you so much for taking the time for this interview.
Bueno, muchísimas gracias, muchas gracias.